spirituality and health today. But first, I'd like to thank Dr. Modi as well as the organization's board to allow me the opportunity to speak before you all today. First, I want to share with you why I'm so excited about presenting this particular topic. I know I haven't been practicing independently medicine for a long time, but ever since I entered the field of medicine, I always felt that a part of me was unable to fully connect with the mainstream Western medicine. And as a result, I started searching in alternative forms of medicine, and some of those ended up resonating more with me, but I couldn't really figure out why. And then in 2014, I had an opportunity to do a month-long integrative medicine elective, which helped me identify what it was that I had been missing. Listening to the different presentations about various forms of non-allopathic medicine philosophies, I realized that the one thing that they all had in common that was often missing from the mainstream Western medicine was the link to spirituality. I realized that the part that I had always thought missing from my medical practice was this connection with spirituality, which had always been a major part of my personal life. And this uneasiness, this unsettling feeling that I had been feeling was the inability to figure out how to connect this big part of my personal life and beliefs with what I do on a daily basis, practicing medicine. As I learned from some great mentors there, I realized that the two didn't have to be separate. And in fact, spirituality can and should be a major part of our everyday practice of medicine. So without further ado, I'd like to move on to today's goals and objectives. Today we're going to talk about identifying the role of spirituality in maintaining health, identifying when it's appropriate to take a spiritual history in a medical setting, and then how to do it. Before we do that, I think the first thing we have to do is define what spirituality actually is. And it can be defined in many different ways because it means something different to each individual. We could define spirituality as a belief in a power that's operating in the universe that is greater than ourselves. In Sikhi, we call that power Vaheguru. It can be a sense of interconnectedness that we feel with all living creatures. We could also define it as an awareness of purpose and meaning of life and the development of personal values. And spirituality is often related to religion, but it can also be found through music, art, or a connection with nature. So then the question is, how can this spirituality influence health? And there's numerous ways. What I'm going to do today is use shabads and couplets from Gurbani to connect with all of this, because we could use all the evidence, all the reference, and we talk about evidence-based research in medicine all the time. But to me, the greatest evidence is Guru Granth Sahib. So that's what I'm going to use as my main reference in most of this. And I will go into some research that has been done in the traditional scientific way. So spirituality can help improve coping skills and social support. And if we look at our own religion, the importance that's placed on Sangha, it's one of the most important things that's taught to us. That's our social support network right here. That's why we're partly here today. It can help foster feelings of optimism and hope. Ja milya pura Satgur Amali, ta asa mansa sab pure. But when I met the perfect true Guru, oh my friend, then all my hopes and desires were fulfilled. Sab ich bundi, aas bundi, mile Satgur purya. All my desires are fulfilled, meeting with the perfect true Guru. Spirituality can also help promote healthy behavior. And we find numerous places in the Guru Granth Sahib, in Gurbani, where they talk about the different routine that a Sikh should have, and it's helping to promote a healthy behavior, both of the body and of the mind. Some of the verses are here. God isnan simar prab apna man tan pai aroga. After taking your cleansing bath, remember your God in meditation, and your mind and body shall be free of disease. Spirituality can help reduce feelings of depression and anxiety. I'm sure we've all experienced it at some point in our life. Simro simar simar sukh pabo, kal kales tan mahe mitabo. Meditate, meditate, meditate in remembrance of him, and find peace. Worry and anguish shall be dispelled from your body. Gaviye suniye man rakhiye bhaav, dukh barhat sukh kar lehna. Sing and listen, and let your mind be filled with love. Your pain shall be sent away, and peace shall come to your home. Spirituality can help encourage a sense of relaxation. Sital sang mahasukh paya, sang sang rahyo ola. I have found total peace and tranquility in the society of saints. My honor has been preserved. As a result, as you can see above, spirituality can have many positive influences on our body, and research has shown that it can positively influence our immune system, cardiovascular system, hormonal as well as nervous systems, and as a result leads to prevention of chronic diseases or progression of chronic diseases. And then here I want to show you just one piece of Gurdwani, one body that we recite on a daily basis, the Anand Sahib, and how all of the things we just talked about are present in this one piece of Gurdwani. Anand paya meri maaye, Satguru mein paya, Satgurta paya sahaj seti, man ruchiyan badaiya. Talking about the feeling of bliss. Har naal raho tu man mere, dukh sab visarna, angikaro kare tera, karaj sab sarana. All your sufferings are gone and all your affairs are perfectly arranged. You don't have to worry about anything. Sacha naam mera aadharo. So if you take the name or the meditation or Vaheguru as your support, Karsang Sukhman Ayvasya, Jin Ichha Sab Guzaya, it brings you peace and tranquility and the fulfillment of all desires. So as you can see, optimism, hope, peace, relaxation, the relief from suffering, the fulfillment of desires, all of those are found, and this is not even the full Anand Sahib, these are just some lines from that Bani that we recite on a daily basis. And talk about the role of spirituality, more about that, and how it can help in maintaining health. And what I'm going to do is examine the individual components of spirituality here, and this is where I'll go to some traditional research that has been done and show you some evidence from that. So one of the components of spirituality is faith. Faith has been shown to increase the body's resistance to stress. A 1988 clinical study of women undergoing breast biopsies, women with the lowest stress hormone levels were those who used faith and prayer to cope with stress. Another component of spirituality is hope. Without hope, many people can become depressed and prone to illness. There was a 35-year clinical study of Harvard graduates, and they found that those who expressed hope and optimism lived longer and had fewer illnesses in their lifetime. Another component, forgiveness, the release of hostility and resentment from past hurts. Emotions like anger and resentment can cause stress hormones to accumulate in the blood, and this has been linked to several cardiovascular, autoimmune, as well as endocrine diseases. And there's been new research emerging now that's showing the link of stress and the whole pathway that it starts that leads to chronic diseases like coronary artery disease, diabetes, and even cancer. I want to mention a quote from Mitch Albom's The 5 People You Meet in Heaven, a great book, by the way. If you haven't read it, absolutely should. I would recommend it. In that on forgiveness, he says, learn this from me. Holding anger is a poison. It eats you from inside. We think that hating is a weapon that attacks the person who harmed us, but hatred is a curved blade. And the harm we do to ourselves. I want to mention another field of medicine that I learned about, energy healing here. And And we don't have time to power. And this has been used as a means of healing across all cultures throughout the ages. And throughout the beginnings of medicine, even before we mainstreamed it so much into and divided it into different, medicine is only for the body and not for the mind. When medicine is practiced holistically, prayer was an important part of it. And it's difficult to study the effects of prayer, especially distant prayer, because that also works. But a lot of current research in coronary care units is suggesting that there actually is a benefit. And then more research here. Lechetti et al. Showed that spirituality relates to significantly less depressive symptoms, better quality of life, less cognitive impairment, and less perceived pain. Shah et al. Showed important influence of spirituality and religiosity on overall quality of life in patients with schizophrenia. I'm not going to go through all of these here. There's a whole lot of research. And the Sikh et al., this one was interesting, showed that those who attended religious services at least once per year had decreased odds of subsequent suicide attempts compared with those who did not. And this was a study done in those who were already at risk or had depression. And then Pereda et al. Found that spiritual activation can actually modify pro-inflammatory cytokines and as a result suppress the progression of chronic diseases. And this type of research is emerging more and more now. There's a program, I'm not sure if any of you have heard of it, Dr. Dean Ornish. He's a physician from California who's now coming to the East Coast as well with his program. And he has actually done research to show, he has proven with his research that he can reverse coronary artery disease. He enrolls people with known coronary artery disease who've either had an MI or have undergone a CABG or stent placement, and he enrolls them into this intensive 9-week program, 4 hours twice a week, where he addresses 4 components. And obviously, the 2 main ones are diet and exercise, and we all know now that that works. But the other 2 components, interestingly, that he is making part of that program, one, group sessions to provide the social support, and the 4th component is stress management through various modalities. So, and now he's broadening that more to not only coronary artery disease, but also he's addressing prostate cancer and trying to prove that this kind of an intervention can also work in prostate cancer. So as you can see, as you move forward, there's more and more research emerging that a holistic approach, including all different components of health, is very important. So then the question is, what kind of illness or condition responds well to spirituality? Well, my answer is everything. But just to name a few, it can help heal faster from surgery, leaves you less anxious and depressed. It can help lower blood pressure. It gives us the ability to cope better with chronic illnesses like arthritis, diabetes, heart disease, cancer, spinal cord injury. Now, spirituality cannot guarantee health, but it does increase our chances of better outcomes of disease. I'm going to shift gears a little bit and come back to Gurbani and talk a little bit about what does Gurbani say about human body and disease. And Gurbani says, Kaya mitti andh hai. Our body is blind or besamaj or ignorant dirt. Just like the dirt does not have the capability to feel, our body also does not have the capability to feel pain, sadness, or discomfort. So then what is it that feels? It's the mind. Gurbani says it's the mind that's susceptible to illness and disease and not really our body. Then how is disease defined? What is disease? Gurbani says, "Parmesar ke gulyam vyapan sabe log." Just like darkness is the absence of light, Gurbani says disease is merely the absence of God. Our diseases and troubles are dukh, a result of our inner selves moving away from Waheguru. So then the question becomes, as a physician, this is very hard to swallow. We're treating the body all day long. We're writing prescriptions to fix colds, science has an answer for everything. So it says, how do we heal then? How should we heal? Sab mein jyoti jyot hai soe, tisne chanan sab mein chanan hoye, gur sakhi jyot by gur hoye. Gurbaani says there's a supreme power or light that lives within all of us. And we can use it to be free of all sorts of diseases. It is this healing power that's hidden within us, just like fire is hidden within a piece of wood. How do we reveal this hidden power? With the help of Guru. And actually, not only can we use this power to heal ourselves, but also to heal others. That's why we're doing this. It's not only, we practice something called healing touch all day long, whether we realize it or not. Every time you lay hands on a patient to examine them, you're practicing healing touch. It's not only about what you say to them, it's about how you say to them. Coming back to the field of energy medicine that I was talking about before, every time you touch a patient, there's some sort of energy transfer between the two. And that starts as soon as you enter the room, but especially when you're touching the patient. And whether your thoughts are positive or negative at that point impacts the kinds of health you're providing to that patient and what they're going to gain from that visit. So that's very important. In the talk earlier, we heard, the orthopedist can just go ahead and say, yes, I will operate on you no matter what. But it's not just about that. That's not what, the patient, the scenario that he mentioned where the patient's in the wheelchair and you could do all the operations you want. He's still going to be in the wheelchair. You can do a total knee replacement. But instead, if you encourage them and get them to get up and exercise and go through the process that's necessary, they're going to have better outcomes. So it's about all of that you do. It's not about the prescription you give them, the antibiotic that you give them to help with their cold. It's about how confidently you tell them what's wrong with them and how confident you are when you say it that this medicine will really help you. That's what it's about. All of that plays a role. We harvest this energy, we harvest this healing power, we realize this healing power within us through meditation on the Nam. And meditation is so important, now we know that. And Western culture is catching on to that. Our gurus told this to us a long time ago, and other medicine philosophies have known this, but now it's becoming part of somewhat mainstream, not so much medicine, but at least the culture. And now we're seeing numerous examples of where they're offering meditation in the workplace. So much so that large corporations like Google, HPP, Procter & Gamble are offering meditation programs for their employees. The big companies have found it as a great cost-effective measure because they found that when they allow this meditation space for their employees, the employees are more focused, they can concentrate better, and they get less ill, so there's less missed time from work. And as a result, this is a very good cost-effective measure for them to get on board with this. Not only that, there are now companies emerging, for example, MedWorks, that are training companies that focus exclusively on providing stress reduction meditation courses in the corporate environment. So you could see the scope of this. If something is cost-effective, it will come to the mainstream Western culture, and that's why it's here, but we've known about this for a really long time. So then the question is, when is it appropriate to take a spiritual history in a medical setting? My short answer, as you might have guessed by now, always. And why is that? Because it simply coincides with the good essence of a good medical practice. Why? Because it's two people, the doctor and the patient, engaging in a genuine and meaningful conversation about what matters most. It's involving engaging people as equals in inquiry and discussion using their own words about what at the deepest level makes sense to them, puzzles them, motivates them, or holds them back. Now, it's not easy to do, just like using your stethoscope or your ophthalmoscope. Taking a spiritual history is a clinical skill to acquire and hone. But it's a little bit different than using a stethoscope in the sense that it requires an empathetic engagement with the patient, and it sanctions the judicious use of both intuition as well as initiative on the part of the assessor, the physician. So then you must be wondering, well, how do I do this? How do I translate this into the medical practice? And I'm by no means an expert on this at all. I'm still learning myself. And this forum isn't sufficient to completely do this, especially because this is one of those things which is the art of medicine and not so much the science, so there's no clear cut, this is how you do it and this is how you don't do it. But what I hope to do today is provide you with some building blocks, some starting questions that you may choose to ask your patients if you feel fit. And then from there, you delve into your own journey about how you want to proceed. So a brief screening that we may use is simply asking the patient, are you particularly religious or spiritual? Or if they say no to that, you may ask them, what helps you the most when things are difficult or when times are hard? There's been a couple of questionnaires that have been formulated by different people. So for example, the 5-Gut questionnaire has been formulated by Puchalski and Romer in 2000 in their guide to stating a spiritual history, which addresses the 4 components: faith and belief, importance and influence, community, and then address or action and care. And we'll go into each of these. So faith and belief. What is it that gives the patient's life meaning? And this is kind of like that brief screening that we talked about. Do you consider yourself spiritual or religious? Or do you have spiritual beliefs that help you cope with stress? If the patient responds no, you may ask, what is it that gives your life meaning? Importance and influence. How important is it to their situation? So you ask things like, what importance does your faith or belief have in your life? Have your beliefs influenced you and how you handle stress? Do you have specific beliefs that might influence your healthcare decisions? The C is community. They're placed in social or religious groups, so you ask them just that. Are they part of a social or religious or spiritual community? Is that of support to them? Because sometimes you could be a part of it, but you don't necessarily identify enough with them for that to be your support system. Is there a group of people you really love or who are important to you? Communities like gurdwaras, churches, temples, mosques, these can be also strong support systems for a lot of people. And then A is for address or action and care. How is it that, and we did a house visit for him with the palliative care team, and he wasn't in as much physical pain from his cancer at the moment because he was being appropriately treated for that, but still he was in a lot of distress. And in talking to him further, we realized that his pain wasn't physical at all. It was actually spiritual in nature. He wasn't really afraid. He had made his peace with the fact that he was going to die from this cancer. He wasn't necessarily afraid of dying, but he had, put his affairs in order. He had done all of that. What he was afraid of was, what is it that's going to happen to him after he dies? Where is he going to go? What's going to happen to him? So we just sat around and we talked. And we all, the nurse was there, the pediatrician was there, he's there, so there's at least 4 or 5 of us there, all from different backgrounds, different beliefs, different religions. So we just sat and we talked about what our belief is about what happens to us after we die. He mentioned his, I mentioned mine, we all just kind of talked about it. By the end of that visit, he was in a lot less distress. I don't know what we said that comforted him, or maybe just it was having that act of being able to open up and discuss it or recognize that that's what was bothering him. Whatever it was, something that day comforted him. It's encounters like this that help to remind us that spirituality is an important part if we want to provide holistic care to our patients. They talk about the biopsychosocial model when they teach us in medical school. Especially in fields like family medicine, psychiatry, they really emphasize that. But even then, the missing piece is still spirituality. on our own include that piece because it is very important in one's health needs. That's pretty much the end of my presentation. But in summary, I want to leave you with, again, a shabad from Gurbani that helps summarize the essence of this presentation. Many times in Guru Granth Sahib Ji, it's listed that we can be free of all types of bodily diseases and illnesses if we just surrender ourselves to the Shabad of Vaheguru and meditate on his Naam. So I leave you with this Shabad and we'll talk about it. Tati vav na lag gayi, par brahm saranai, jo gird hamare Ram ka, dukh lage na pai. The hot wind doesn't even touch one who is under the protection of the Supreme Lord God. On all four sides, I'm surrounded by the Lord's circle of protection. Pain does not afflict me. Satguru pura pe tera, jin banat banai. Ram naam aukad diya, ek gal binai. I have met the perfect true Guru who has done this deed. He has given me the medicine of the Lord's name, and I enshrine for the love of the one Lord. Rakh liye tin rakhan har, sab vyad mitai. Kaho nanak kirpa kari, prabh paye sahai. The Savior Lord has saved me and eradicated all my sickness. Says Nanak, God has showered me with his mercy. He has become my help and support.